to a video on OCR History B, People's Health, 1750 to 1900, which is the industrial period. So this is a contextual understanding video. The video on how to answer the questions is in a separate playlist. So just to go through the timeline once more, I know that we should be quite familiar with this, but we have our first time period, which we have already covered, medieval England, 1250 to 1500, the 13th to the 16th century. We then have early modern Britain, 1500 to 1750, the 16th to the 18th century. The period that this video is going to focus on is industrial Britain, which is 1750 to 1900, the 18th to the 20th century. And then finally, our last time period is 1900 to today, which is modern Britain and the 20th to the 21st century. As I've said previously, it's really important that you know the names of these time periods along with the dates and the centuries, because the exam board can ask you a question based on these time periods, either using words, as in the name of the time period, centuries, or the dates. So here you can see the bullet points that the exam board have provided us with in terms of what we need to cover for industrial Britain. We've already completed medieval and early modern, as you can see on screen. So for industrial Britain, 1750 to 1900, they ask us to cover the industrialisation and the growth of major cities and political change. Urban living conditions in the early 19th century. Remember, any question on living conditions would encourage you to speak about housing, food, water and waste. The responses to the cholera epidemics that broke out in Britain during the 19th century. And then finally, public health reform in the 19th century, including the Public Health Acts and local initiatives. Start by looking at an overview of Britain between 1750 and 1900. I'm going to start with beliefs. So by 1900, right at the end of our time period, Darwin's idea of evolution was beginning to become accepted and the belief in religion declines. The real turning point in this move away from religion was Louis Pasteur's discovery of the germ theory in 1861, which leads many people to start to look towards science for the first time, which is going to have a really positive impact on public health. In terms of democracy, until 1832, only 5% of the population could vote, but the acts throughout the 19th century eventually gave more men the right to vote than ever before, including working class males. This meant that for the first time, governments were alerted to the needs of poorer people. It is worth noting here that women are not included in these statistics, and that is a result of women not receiving the vote until the 20th century. In terms of transport and technology, by 1850 there was a large network of railways throughout Britain, so we start to see steam trains appearing and replacing methods of transport such as horse and cart. We also see steamships that are sailing with goods to and from the British Empire, so we have a complete revolution in the way that transport and technology are perceived throughout this period. We've then got work. People stopped working from home in what was known as the cottage industry, and they moved towards factories. Factories had dangerous working conditions and high levels of pollution. So in 1841, we have a statistic of the average life expectancy just being 26 years old due to the dangerous conditions within the factories. We then have towns and cities. So urbanisation begins on a mass scale, and this is people moving from rural areas to urban ones in terms of work. Trains are allowing people to move around the country in search of new opportunities in terms of jobs. So we see a big change here and a shift in where people are living and working. Finally, we have some statistics in terms of the population. So in Britain in 1750, the population was 6 million. By 1900, this has grown to a huge 37 million. So the middle classes are also growing in number and power, and this leaves the working conditions of the poor still largely ignored. A huge change takes place in 1870 when children became entitled to free education under the age of 10. This is going to increase literacy rates, which is another huge change during this time period. So an important thing to note as we go through this is that the living conditions during industrial Britain were exceptionally poor, and as a result of that, they have a really negative impact on people's health. So we're going to have a look at some different features of urban life, so what life was like in the towns and cities, what caused this feature, and then what effect this had on public health. So in terms of industrial towns and cities being overcrowded, we have, in terms of what caused this feature, huge population increase. We've just been through the statistics on the previous slide. We have migration from rural to urban areas, so lots and lots of people begin to move from the countryside into cities for work. And the housing quality was poor and rents were high, which meant that lots of people were just living in one room. So diseases are going to spread very, very easily in places like this. So remember, the population jumps to, by 1900, up to 37 million. In terms of the effect this had on public health, there weren't enough privies, which remember is a toilet without a flushing system. So human waste was simply flowing out onto the streets, and there wasn't the infrastructure to deal with this. And diseases like tuberculosis or TB were common due to the damp walls in poorly built houses. By 1842, 57% of children born in the working class districts of Manchester were dying before the age of 5 as a result of conditions such as this. So we know that this had a huge negative effect on people's health. There also wasn't any help for people who were poor, and that is still a large percentage of the population. The reason for this is because rich people who ran town councils didn't want their taxes to increase to enable them to pay for water and waste facilities. So as a result of this kind of selfish perspective, the poorer people and the larger percentage of the population aren't getting any support. And this is also tied in with the fact that the government still largely believed in laissez-faire, which remember means that the government are not choosing to intervene to help the majority of the population. In terms of the effect this had, there was no free healthcare available for people. Doctors and medicine had to be paid for, resulting in many of the people who became ill due to housing and waste conditions simply dying. So you had to be wealthy at this time if you were to receive medical attention. Finally, unsurprisingly, because of the previous two categories we've looked at, disease was very common. So until 1861 and Louis Pasteur's germ theory, people did not know about germs. Many people were continuing to drink dirty and contaminated water, and people, as we said, are still living in overcrowded homes. And all of this is leading to a spread or an increase of disease. The 6 biggest killers during this time period are TB, influenza, diphtheria, typhoid, typhus and cholera. There is a 1-mark question that has appeared on the paper which asks you to name another disease during the industrial period that isn't cholera. So it is worth making a note of a couple of these 6 biggest killers. Disease was spreading quickly and people did not understand why. Remember, lots of people until the germ theory are still looking towards religion rather than science. And life expectancy was low, infant mortality was high. Remember that statistic I've just given you about lots of children in Manchester, over 57%, dying before the age of 5 in 1842. So just a reminder that a question on living conditions would enable you to speak about housing, water, waste and food. So we're going to start by having a look at housing. Hopefully you can see on the screen these houses are back-to-back houses. So we'll go through what those look like and what those were in just a moment. Before we do that, we're going to have a look at this information here, which states that all large towns had lodging houses where single people lived and newly arrived families looking for houses to rent. They were often large old houses which were divided up into smaller rooms, and they were filthy and overcrowded, with many people simply having to sleep on the floor. As a result of these conditions, we have diseases such as typhus, which were passed on by body lice, which were spreading extremely quickly. I have highlighted on some of these slides again what is change and what is continuity. So this is a change, these idea of lodging houses, and something you could speak about in the exam. To bring us back to the image that I showed you or spoke to you about at the start of this slide, you can see the back-to-back housing. So this back-to-back housing were terraced houses that were built in double rows. So each house had its own front wall but was joined to others at the back and the sides. Large families shared these with one room upstairs and one room downstairs, and the ventilation in these houses was extremely poor, and chest infections and TB were common. So if you have a look at this house here, that hopefully you can see the laser on screen, once you imagine that you've just sliced that down the middle there. So this half is one house and this half is another. So they are sharing the back wall of their houses and they just have the front wall. Normally these houses would be one up, one down, as it says in the information that you can see. This is also a change. It's a new type of housing that we have, and although it helps with accommodating the growing population, the quality of this housing is extremely poor. And finally, the very poorest people rented below ground in the cellars of other people's houses. This is continuity from the time period before, but disease, again, just a reminder, is going to spread extremely easily in conditions such as this. So in terms of water and waste during industrial Britain, we're going to start with water first of all. So in working class areas, it was very rare for anyone to have piped water into their homes. So this was the same as the time period before. It's only the very wealthy that can afford to do this. But what is a change is that whole streets often shared a water pump, which would often only provide water for up to 3 hours per day. So this is how the vast majority of people are accessing their water in industrial Britain. Water companies were sourcing their water from ponds, rivers and streams, which were often dirty and unhealthy, meaning cholera and typhoid were prevalent. Now, at this time, remember, initially people did not understand that contaminated water was causing cholera. So the water companies keep sending this water to the water pumps, and this is obviously making people very ill, but people do not realise this at the time. Poor families were sometimes unable to afford the water company's charges, so as a result they have to collect water from a spring, a stream or a river. This is continuity from the previous time period of early modern Britain. Remember, this water is not going to be clean, so again those diseases such as cholera are going to spread. Middle class families were filtering their water. This is a change, so again it is likely that the epidemics like cholera are going to hit the poorest the hardest. And finally, people did not understand, as I've referenced, just that contaminated water caused disease, and this again is continuity, a lack of scientific understanding. In terms of waste, the existing sewers had been built originally to drain rainwater, not human waste. So when the population increases and there are all these back-to-back houses built, for example, the existing sewers are not built for purpose. In most areas with back-to-back housing, the sewers could not cope, as I've just referenced, and in a typical street of industrial housing, over 10 families were sharing one privy. Some privies were connected to a cesspool, which is a brick container, usually about 6 feet deep and 4 feet wide. And these were then emptied by night soilmen who scooped out the sewage with a bucket and sold it to local farmers. So we spoke about in early modern Britain the idea of sewage being sold on. So this is the same kind of concept, hence the fact that continuity is on the screen. It would be good to reference the name night soilmen in the exam. More middle and upper class people were using flushing toilets, which remember were created at the end of the early modern period. And often where sewers were built, the waste was emptied into rivers where the water companies got their fresh water from. Additionally, cesspools were often located close to wells and water pumps. Remember, this is going to be a huge cause in the cholera epidemic, as much as people don't realise that that is the case. And people are still very strongly under the illusion that miasma is what is making them ill. So this prevents any kind of progress really in finding out what causes cholera. Final section for living conditions is food. We're going to have a look at what the industrial poor, what their diet was like and what the effects of this diet were, and whether it was change or continuity. So first of all, it was impossible to grow food in the slums of cities. Remember, people have now moved into the cities rather than being in the countryside. In early modern Britain and medieval, they would have been able to grow lots of their food themselves. But in the industrial period, this is no longer the case. So they have to buy their food from small shops and street sellers. And this is a big change to what we've seen previously. Food was expensive and many had large families to feed, so it was difficult to get access to vegetables, which again is a change from people that were living in rural areas. So the poor's diet changes to include predominantly bread, butter, potatoes and tea. So again, you could reference this in the exam as a change. Occasionally, there would have been cheap bacon, rabbit or offal as a treat for labouring families. So just a note here that offal is the entrails and the internal organs of an animal. So it's not the best cuts, and this is what the poor would have had on occasion. And the quality of food was very poor, and it was often adulterated. So by that we mean that items are added to the food, which makes them not pure. So butcher's meat was sold from diseased animals, cow's milk had water and chalk added to it, and butter had copper added to improve the colour. So all of these are examples of food being adulterated, and obviously these things could have made people ill. Occasionally the poor would have had access to eggs, cheese, fish and meat. That is continuity from early modern Britain, but just a reminder that this is very occasional. In terms of effects, many of the industrial poor are malnourished, so they are not having enough nutrients, enough calories throughout the day, making them extremely thin, and this makes them more prone to sickness and disease. The adulteration of food also means that many are dying from diarrhea and food poisoning, so they are getting ill as a result of the quality of food that they have to eat. The epidemic that you would need to reference in the exam is cholera, and there have been numerous questions on cholera which we will see at the end of this video. So just a reminder that cholera is caused by contaminated water, and in Britain water was becoming contaminated by the excrement of people who carried the disease due to the lack of sewage systems. There were cholera epidemics throughout the 19th century, and a statistic that I would encourage you to reference in the exam is that it killed over 100,000 people. So we're going to have a look at what the beliefs about the disease were during different parts of the 19th century, what the national government reaction was, and then what the local government reaction was. So first of all, we're going to start off with the 1830s. So in terms of the belief about disease, miasma was still the main belief, and the idea that cholera was coming from God due to sinning. So this is showing us that we have a lack of progress as a result of religious beliefs. There is one positive in the fact that there were becoming people who are making connections between dirt and disease, but these are very few and far between. The germ theory is not yet being discovered, and as a result of that, people are still putting faith in miasma and religion. In terms of national government reaction, we can see here the lack of scientific understanding, because one of the ways that they dealt with cholera in 1832 was to introduce a national day of fasting, humiliation and prayer, which obviously did nothing to stop the spread of the disease. But in a more positive kind of vein of thought, they have an introduction of the Central Board of Health, which was to study cholera in other countries. So they are at least looking at the idea of research, and that is a move in the right direction. In terms of local government reaction, all of these things do very, very little to improve the situation. So we still have burning tar to purify the air, something that Elizabeth I, remember, introduced during the Great Plague. Clearing rubbish from the streets, quarantines to stop poor people entering towns, separate hospitals and graveyards to stop contamination, and finally health boards to give advice. Now, as much as some of these sound more scientifically based, such as clearing rubbish, quarantines and health boards, because the government do not understand the link between contaminated water and cholera, the advice that they are giving is not going to be helping people. So the kind of ideas behind it are a move in the right direction, but very little is going to be achieved. So all of the red bits of information that you will see in this table are kind of negative, and the green bits are positive. So you can see here in the 1830s, very little progress really has been made. In 1848, we have Edwin Chadwick. He is a name that you would need to know for the exams. I've highlighted that for you. And he produced his sanitary report, which contains shocking details of a public health crisis. So the Public Health Act, as a result of his sanitary report, is set up in 1848, and it sets up the General Board of Health, which encouraged councils to set up health boards and clean up towns. So, for example, houses were expected to have a clean water supply. But the towns could only be forced to do this if deaths in their area were higher than 23 per 1,000 people. So as a result of this, I've put the word encouraged in red because this is not a compulsory act, and therefore there is going to be a limited effect, which we can see from the local government reaction. So lots of towns choose not to enforce this Public Health Act because they believe that change would be too expensive. They're going to have to raise taxes to cover this. And by 1853, only 163 places had set one up. The local ratepayers or taxpayers resent the increase in tax needed to enforce the Act, which means that very few people, or very few places, enforce this Public Health Act. So it has limited results. We see a real breakthrough with John Snow, and he is the individual that proves that cholera was spread through contaminated water. So you really do need to know this as a turning point for the industrial period in the exam. And John Snow found that a water pump near his surgery was the cause of the disease in his area. And as a result of this, we would expect there to be a huge reaction from the government. Sadly, this takes quite a lot of time to get through to any kind of government reaction. So we have laissez-faire, which continued, and the General Board of Health that had been set up following Chadwick's sanitary report actually gets abolished. And we have no local government response at all. So even though there's this huge scientific breakthrough, there is not really an appetite to listen to what John Snow has to say straight away. However, this changes by 1866, and the ideas of Snow are finally accepted. And kind of linked with this is the fact that in 1861, Louis Pasteur had proven that germs cause disease through his germ theory. So this is really our turning point. So in terms of national government reaction as a result of that, we have the Public Health Act of 1875, which follows, which made local councils responsible for sewers, water supply and street cleaning, and good sewers limit the impact of the cholera epidemic in 1866. So we definitely see a move in the right direction. And in 1865, in terms of local response, Joseph Bazalgette introduces a new sewerage system for London, and this completely revolutionises public health and reduces the spread of disease. So you should be able to see here that all of the local government reactions in the 1830s prove that the government were trying to limit the spread, but they are all, or up until 1866, they are all in red because none would have worked. They did not understand the link between contaminated water and disease, and even the health boards, as I stated, which were a positive idea, would have been disseminating incorrect advice. Overall, though, there is a huge change during this time period. In the first half of the 19th century, there was still a belief in miasma and God-causing diseases. However, due to the scientific advancement of Pasteur and Snow, the government began to abandon their laissez-faire attitude, as the 1875 Public Health Act proves. Remember, this new law forced local councils to take responsibility for cleaning up their towns, which included the appointment of health inspectors to monitor its implementation. So we can see real progress. Beliefs about miasma have now been replaced by an acceptance of the germ theory in 1861, and research into how disease was spread led to national and local government focusing on providing clean water and successful waste management, such as the replacement of a midden privy with a pale privy. So we can really see a move away here from laissez-faire, and that is definitely a change that you would be expected to explain in the exam. Kind of contextual piece of information that we need to know are what the government did to introduce some public health reforms. We need to know when they happened, what was their reason for introducing them, and finally what progress and limitations there were. So first of all, in 1860, the government introduced a reform called the Adulteration of Food Act. And the reason for this is that when there were no laws to protect people from eating unhealthy food. For example, bread was often made with a combination of flour and something called alum, which was potassium sulfate, and that is a substance that is commonly found in fertilisers in modern England, to give you a taste of what people would have been eating. Obviously here by unhealthy food, I mean contaminated food, food that has had things added to it. So we're not talking about food here with high fat and high sugar. We're talking about people that have made the food, adding products to it, which reduces the quality of it. So in terms of progress and limitations, there is progress because it is the first law to try and prevent contamination of food. And we also see the development of food analysts, so scientists analysing what is in people's food for the first time. It's a real sign that laissez-faire is disappearing. However, despite that, there are some limitations. There were only 7 analysts who were appointed, and there was no compulsory inspections of food, which often means that the law or the act is ignored by many. In 1865, we have the opening of Bazalgette's new London sewerage system, and the reason for this is that the London sewers were flowing into the central part of the River Thames, which caused the Great Stink in 1858. The Great Stink in 1858 would be a great specific for you to reference in your exam. And the theory of miasma was still lingering. So when the smell is so bad in central London, people believe that that is what is causing disease to spread. In terms of progress, we have 1,300 miles of sewers that are built in London due to Bazalgette. That would be a great statistic for you to reference in the exam. We've got low-level sewers that are built behind embankments, which are taking waste to a treatment plant. And then we have the spread of waterborne diseases such as cholera being prevented. So the opening of Bazalgette's new London sewerage system is huge progress and a real big change that we see during this time period, something that would be great for you to reference in the exam. In 1866, we have the Sanitary Act. So the reason for this is that there was another cholera outbreak and there was a need to make local authorities responsible for public health, which leads to this development. In terms of progress, it forced local authorities to provide fresh water and waste disposal, and all houses now had to be connected to a main sewer. If local authorities didn't carry out the work, then central government did the work for them and billed them for it. So this was pressure from central government to make local authorities act, because if central government did the work, the likelihood is the cost would be much greater. In terms of a limitation, it's just very slow to be put into operation. So there's clearly a move towards improving living conditions for people by 1866, especially in terms of water and waste. It is just slow to be enacted. In 1891, we see the slum clearance that happens in Spitalfields in London. There was a need to clear the overcrowded, unhealthy slum dwellings, which were encouraging diseases to spread. And in terms of progress, the newly established London County Council ordered the clearance of the overcrowded Old Nickel slum. For those of us going for 7s, 8s and 9s in the exam, that's something really specific that you could give as and in replacement of these slums, we have new modern 3-room tenements which were built, and these were connected to fresh water and drains. So again, we see an improvement here in the living conditions of people in the 19th century. Finally, in 1894, we have the opening of the Thirlmill Dam, which is in Manchester. Cities like Manchester were finding providing fresh water quite challenging, but developments in engineering allowed the dam to be opened. And this leads to huge progress because we have fresh water being carried from the reservoir to central Manchester, which was a hugely successful feat of engineering, and it's helping provide people in these new houses with clean water, which is obviously going to lead to less waterborne diseases like cholera. And it also encouraged other cities to fund similar projects, so it has a really positive impact. So all of this evidence, it's worth noting, is from the later half of the 19th century. So if you were asked a question in the exam about the earlier half of the 19th century, this evidence is not applicable. But for the second half of the 19th century, it is. And the more specifics you can give, the better, really. You could also refer to the 1848 and 1875 Public Health Acts as part of public health reforms. I haven't gone through these here on this table because we spoke about them during the information on the cholera epidemic. Have a number of past paper questions from the industrial time period. You can see that the exam board used centuries, dates and names of the time period to identify industrial Britain, meaning, as I said right at the start of this video, that you need to be confident with all three. So please feel free to have a go at some of these questions as part of your revision. You can see that industrial Britain is a popular time period to question you on, because there is a spread of questions for 1 mark, 9 mark, 10 mark and 18 mark questions. So yeah, please have a go at some of these. Ask your teachers if they will look over them for you, and please feel free to use the video that is on how to answer the questions to help support you write some responses. So the last video in this series for the People's Health will be for the modern period, 1900 to present day.